Avik, there are two ways to look at this. The slowdown in healthcare cost growth. Is this a business cycle issue or is this a long-term trend?
It's both. So the slowdown in growth in healthcare spending in the U.S. began in 2003. So it's been, in that sense, a long-term organic trend.
Yeah.
But there's also been a significant slowdown in the advanced economies around the world since 2008. So if you look at the OECD countries and the U.S., the slowdown in the growth of health spending has been global.
You know, one of the things that happened as part of the Affordable Care Act, there were a bunch of smaller measures designed as experiments to see whether the cost of health care could be brought down. None of them were wide scale. Is there any promise coming from any of those that could be turned into policy?
I'd say by and large the answer is no. There's one tweak in Obamacare that has led to some lower costs, which is punishment for hospitals that have too many patients go out of the hospital, then come back in for the same problem, readmissions. So because hospitals are getting less reimbursement from Medicare for that, that's reducing health expenditures.
And
for that
that's really working. I've been up to Mount Sinai. They have really changed protocol. They have hired in extra people, extra social workers to try to bring down those readmission rates. Avik, my question for you is what role are drug prices playing in runaway inflation? You know, we have a headline here this morning, Gilead going to cut the price of its Hep C drug by $1,000 to just $83,000 a year.
Yeah, so in that particular case, competition is helping out. So AbbVie has a new drug that competes with the Gilead drug, and that, of course, is driving prices down as they battle for market share. Broadly speaking, the U.S. actually is reasonably healthy on drug spending. It's only about 9% of overall national health expenditures, which is lower than the industrial average. And the reason for that is almost 80% of drug prescriptions in the U.S. are generic drugs, which are very inexpensive. So we focus on the expensive branded drugs from companies like Gilead, Pfizer, Merck. It's the generic drugs that really drive drug spending.
Right. Within this, and I think for all of us, our eyes glaze over on the Affordable Care Act, what is the distinction between your treatment of the savings we're seeing from, say, someone like Peter Orszag, who's been a supporter of Obamacare? What is that distinction between you and Dr. Orszag?
Yeah, so Peter Orszag talks a lot about the growth in Medicare spending specifically, so a federal program, and how that's been slowing down, and talks a lot about how maybe there have been policy changes that address that. I look more at the Congressional Budget Office's data and the OECD data. What the Congressional Budget Office says specifically about Medicare is that a lot of that slowdown is driven by the
economy.
And the George W. Bush prescription drug benefit in 2003, which has grown at a much lower rate than people anticipated.
Oh, but let's look forward. The Affordable Care Act was about coverage. The next fight is going to be about how you bring costs down. Real quick, what's your prescription? What's two things that we can do to bring costs down in the future?
The number one thing we have to do is put consumers in charge of their own health dollars. If somebody else is paying for your health care, you're going to waste the money. It's like an open bar versus a cash bar. You know, if it's a cash bar...
Michael Bloomberg is paying for my health care, and I'm very grateful for it.
He's also paying for your cash bar. Last night.
So that's number one. And number two, I'd say, we actually spend an enormous amount of money in this country, trillions of dollars a year, subsidizing health care for the wealthy. If we actually subsidize health care for upper-income people less and for lower-income people more, we'd have a much more balanced system. We'd spend a lot less.
All right, get rid of the Cadillac health care plans.